this summer because of unsightly veins? Well, if so, don't be embarrassed. Beautiful pain-free legs are possible with the latest laser technology at Invisivein. Now, Invisivein can treat your problem areas with minimal pain and amazing results. Dr. John McHugh is here with all the answers. Welcome to Low Country Live.
Thank you, Erin.
Welcome to our new set. It's
It's
nice to
very
sit
nice.
down with you. So I just want to start. I mean, we've all heard about them, and I think we have a general idea, but technically, what is a varicose vein?
A varicose vein is a dilated, meaning too large vein. It's typically located just underneath the skin surface. The technical definition of it's greater than about 4 millimeters, which is about 1/4 of an inch.
Okay, and how common are they in women? Is it as we age? I was telling you, as we have children, you know, when do they kind of pop?
It's a common problem, and not just limited to women.
Okay.
A lot of my patients are men also. I think you notice it less in men because, you know, we don't shave our legs.
You can hide it a little bit better, right?
And varicose veins are much more than just a cosmetic problem. Many of my patients come in and they describe typically kind of an achy pain, especially at the end of the day, especially if they've been on their feet a long time.
Yeah, and they can be, you know, very painful. So that's where you come in, not only
That's
just
right.
for the aesthetics of it, but to ease the pain. So I know you guys, I don't want to chop this word, endovenous laser? Is
Yeah,
that what you use?
yeah.
What is that and what does it do?
That's a way of treating varicose veins. Endo means inside, and venous just means vein. There's one large vein that runs up the inner aspect of everybody's legs that is the one that most commonly causes the other varicose veins, and we treat that. In the old days, people used to do a fairly large surgical procedure called vein stripping to remove that vein, and now we're much more technologically advanced and minimally invasive. And with endovenous, I put a small catheter, a small tube, inside that vein, hook it up and put in a laser fiber optic filament. And we hook it up to a laser. The tip of the catheter gets hot, and we slowly cauterize the inside of that vein.
Wow.
A much better way of treating that vein and making it go away rather than the old surgical method.
Yeah, so instead of the surgery, how fast is this? If I have a problem, can I go in and have it removed within a day, or is it continuous treatments for a while?
Typically, first of all, insurance companies, most of them do pay for this type of
that's
treatment, especially if the patient's symptomatic. If the
it's
woman or
painful.
man is not having any symptoms, I advise them, you know, just wait until you do, and you may never have it. But there's usually a series of office visits, you know, meet the patient, typically do an ultrasound to help define the anatomy and figure out what the patient needs. And then most insurance companies have about a 3-month period of conservative therapy that they like to see before they will authorize for their treatment. So unfortunately, you typically can't come in and get treated in the same day. It's usually a couple-month process.
Which makes sense.
But the day of the procedure is just a single procedure. You know, you're with us for a couple hours, and we mildly sedate you, and you go home. You walk out of the office with a compression stocking on, right?
So what do I need to consider, anyone watching, if you're looking to choose, you know, a treatment facility for varicose veins? Are there certain things you could look for specifically?
You know, obviously look for a place with a long experience. Our center, Invisivein in Mount Pleasant, has been in operation since 2003.
Been around a while, yeah.
You know, we've got a lot of experience treating varicose vein patients, and we have an excellent track record of successful patients. You know, I would encourage you to talk to the people. You know, it's a common enough disease that many people have had it. Talk to your friends and family members, see where they've had a good experience. Hopefully, my office, Invisivein, along with my partner, Dr. Mullaney, will rise to the top of that list.
Now, you said you have to do the initial consult, and it's, you know, a process before you actually have the procedure. But once you do, is it gone, you know, that day? Like, how quickly
You know,
can we get in and out?
don't want to mislead patients and say, you know,
Yeah.
they're going to be completely pain-free right away, because there are some...
You don't do it the week before vacation.
Right. There's some procedure-related pain. You know,
Yeah.
there's some bruising and pain along the course of that vein that we cauterized,
Yeah.
and that takes a couple of weeks to completely resolve.
Yeah.
But, you know, typically I see the patients back 1 month after the procedure, and at that time they don't have any activity restrictions, and they've recovered from the procedure.
And what do your patients say about all this? I'm sure they're amazed at, you know, what you can do.
Yeah, it's very gratifying for me personally when I see patients and take a person with big ropey varicose veins that have chronic pain. You know, all day, say the woman's a hairdresser, and she's on her feet all day long, and I can take that woman and make her pain-free and make her legs look great at the same time.
And again, where can people go to find you guys?
We're at in Mount Pleasant at the intersection of 526 and 17. There's the address up there.
Call 881-4020 or go to invisivein.com. Doctor, thank you so much for being here with us this morning.
Thank you, Erin.
And we'll have much more on Low Country Live coming up right after the break.